Okay, let's talk specialization. Now, specialization is one of those things, especially in middle school and high school, it's just not needed. Not from a sports perspective, and definitely not from a strength and conditioning perspective. Now, we're dealing with the same body. And so if your kiddo is a volleyball player, a basketball player, a football player, a softball player, the traits required of those sports kind of are still all the same. They need to be able to get up and go fast. They need to be able to react fast. The stronger they are, the more force they produce, so the harder they hit the bat, the faster they throw the ball, the quicker they run when they're stronger. They need to be conditioned in such a way that is optimized for their sport, so that can be a little different. But when it comes to actually training them, in the weight room, we're training the organism, the thing, the physical structure that kid resides within. And so they have an ankle, they have a knee, they have a hip, they all have the same muscles. All those muscles respond the same to specific exercises. There are certain exercises that are just better at performing and producing certain adaptations over others. And so if we want to just make kids' legs stronger, the back squat is just a great exercise for that. It can be loaded relatively indefinitely. It stresses glutes and quads equally when performed at full depth. It strengthens adductors. It produces a lot of mobility when performed to full depth. So whether it's a volleyball player wanting to jump higher and needing to develop a stronger base to develop her power up top, or we have a softball player who wants to hit harder, and so they need to learn, or they need to have enough force and power within their hip to come through on that ball. They just all need to be stronger. And so we wouldn't have special exercises for softball players over basketball players, over football players, because the way that we make legs stronger is, as an example, with a varied diet of squatting, deadlifting, lunging, stiff leg deadlifting, etc. Those in and of themselves work for every athlete of every age, etc. If we want to get better at rotating, which most athletes perform some kind of rotation, they all are going to be doing some kind of med ball hip toss or med ball chest pass drill. They don't need to make the med ball drill specific to their sport or make it try to look like their sport, because then you lose something. A lot of the times us in strength and conditioning do a drill a certain way because that causes the best adaptation from their body, because it allows them to perform the drill the quickest with the most amount of snap, the most pop from it. And so when you take a drill and you try to tweak it a couple of ways to make it look like their sport, look too much like hitting a ball with a bat, you lose something in that you might lose the amount of external force you can perform the drill with. You might not be able to be as quick with the drill, etc. And so then we don't develop the trait of fast, hip-driven rotation. Whereas in practice, that's where you take the strength and the power that you developed within the weight room and you learn to transfer that over to the skill of your sport. And so strength and conditioning is not to make you a good softball player, a good basketball player. It's to make you an exceptional human specimen that can exemplify strength and power and speed and agility, that you then go to your sport to learn how to take that skill that you've come in with and transfer it over to the skill set of your sport. And so too often do I see high school or college as well, coaches trying to make the weight room look too much like the athlete's sport instead of look like something that's meant to cause physical adaptation within the organism, which the body is that the athlete resides within.